The work of scientists such as Koziak, Reswick, and Rogers supports the time-pressure relationships with repositioning and pressure injury prevention. It is now commonly understood that offloading tissue pressures and limiting the amount of time a patient's body surface areas are exposed to pressure plays a key role in preventing and treating pressure injuries. Limited or impaired mobility is established as a nursing diagnosis when a patient experiences decreased ability to move. Pressure injury prevention should be a high priority across the healthcare continuum. A pressure injury prevention program, which does not address repositioning strategies, would be considered a deviation from the standards of care established by the United States, European, and Australian guidelines. Although such guidelines effectively address the safety of the patient through regular turning and positioning schedules, they do not address the safety of the healthcare provider. Achieving a regular turning and positioning schedule for each high-risk patient is becoming more challenging due to a number of issues such as challenging nurse-to-patient ratios, the increase of patient obesity, as well as the high numbers of lifting-related healthcare professional injuries. Every day, nurses and other healthcare workers suffer back and shoulder injuries, debilitating pain, and often career-ending musculoskeletal disorders due to manually lifting patients. A nursing professional lifts an estimated 3,600 pounds or 1,635 kilograms per shift. Nurses rank 6th among all occupations for the highest incident rates of musculoskeletal disorders, resulting in days away from work. The American Nurses Association developed the Handle with Care campaign back in 2003. Since then, 11 states have enacted safe patient handling laws. A paradigm shift has occurred. The safety of healthcare workers is now recognized as a key factor while providing pressure injury prevention to our patients. Safe patient handling also greatly impacts the patient experience, resulting in fewer falls, friction burns, dislocated shoulders, skin tears, and bruises. Patients also report an enhanced sense of dignity and satisfaction. Now I would like to switch gears from why it is important to introduce safe patient handling programs to how. I will take you through a very brief overview of a performance improvement project conducted at St. Francis Hospital, a 315-bed acute care hospital in Roslyn, New York. In 2013, the St. Francis Hospital's professional nursing practice model was used to evaluate current best practices in repositioning immobilized patients. The model was then used to evaluate the Mölnlycke Tortoise turning and positioning system as part of the overall pressure injury prevention strategy. The Mölnlycke Tortoise turning and positioning system consists of two components, a pad and a fluidized positioner. The design of the pad provides visual guides to make it easier to center the patient on the bed, reinforced handles which facilitates ergonomic handling in a low air pressure chamber which provides extra pressure redistribution. The fluidized positioner molds to the body contours to secure the patient at the desired angle while providing continuous body alignment between turns. The overarching goal of the Performance Improvement Project was to maintain current quality of care to patients who require repositioning while decreasing risk of injury to direct care staff during the process. Metrics evaluated pre-intervention in 2012 and post-intervention 2013 included monthly point prevalence of hospital-acquired pressure injury rates, caregiver injuries and claims related to boosting, lifting, and turning immobilized patients, and specialty bed rental costs. In 2013, the hospital spent $42,000 on Mölnlycke's Tortoise turning and positioning system. The evaluation revealed a number of positive outcomes associated with the introduction of the system, some expected and some unexpected. Pressure injury rates decreased slightly, although they were already well below the national average. In addition to seeing a decrease in hospital-acquired pressure injuries, there was a major benefit of a 55% reduction of incidents and injury claims related to patient boosting, lifting, turning, and positioning. Pre-implementation of the system, there were 31 injuries with claims. Using OSHA's estimated cost of $16,000 per injury claim, our study found those 31 workers' claims would cost $496,000 US. After implementation, there were only 14 injury claims, which equates to cost savings of approximately $271,000 US. An unpredicted reduction in bed rental usage occurred simultaneously with an annual cost savings of $58,000 US. And the best benefit of all, a reduction in hospital-acquired pressure injuries. This $42,000 investment equated to savings of $286,000 US in a 315-bed acute care facility. Imagine the savings to global healthcare if this product was integrated into safe patient handling programs around the world. I thank you for your time and consideration.